welcome back to another episode of ICU. Today I have Rachel Gofman with me. She is a doctor of physical therapy and a pelvic pain coach who helps women heal their chronic pelvic pain through a holistic mind-body approach. Rachel, welcome to ICU. I'm excited you're here.
Thank you so much. I'm so happy to be here.
Yes, we're going to have a really fun conversation today. And I actually only know a little bit about you just through social media. So I wanted to see if you would be open to sharing more about your story and how you got into this work.
Absolutely. So happy to share. I'll try to keep it as brief as humanly possible. I think so many of us have a long story of how we got here, but I'll try to give a Cliff-ish notes version of it.
Sounds good.
So I basically do this work because it literally saved my life. And it also found me. So I developed chronic pelvic pain back in early 2016. I developed what I thought was an infection. And I did what everyone does when they have an infection. You go to the doctor, get testing done. And I was told nothing is wrong with you. And I said, well, that's not possible. Please test me again. And so I did this about 6 or 7 times with the same non-results. The doctor had given me a variety of medications like antibiotics and yeast treatments just to see if they helped. And they may help a little bit for a day or two, but then some symptoms persisted and got worse. And so finally she's like, I don't know how to help you. So I obviously was very afraid and very panicked and went to go see probably 6 other gynecologists who all did quite similar things. I eventually got a transvaginal ultrasound and a pelvic MRI and a brain MRI. And in this time, my symptoms were spreading and expanding and shifting and changing. So I ended up having basically a burning vulva, burning clitoris, burning urethra, urinary frequency urgency, a whole variety of pelvic pain symptoms. And so the doctors at the end gave me a variety of diagnoses, such as unprovoked vulvodynia, pudendal neuralgia, and interstitial cystitis, which, as I'm sure your audience knows, are really terrifying diagnoses to get. Because essentially what I was being told was you have these incurable conditions. We can offer you these expensive, invasive, and temporary treatments, but there's no really hope for a cure. So do what you want, basically. And so I didn't do any of that because they couldn't explain to me why I had what I had. And so ultimately, I had to go back to the drawing board feeling, completely hopeless at that time because I did what you're supposed to do. Like the Western medical system says, you go to the doctor, they have the answers for you, they give you treatment, you get better. And so that was not my experience, and I had to figure it out myself. And I'd kind of been there before. So about 6 years prior, I had developed chronic low back pain and sciatica kind of out of the blue. But it wasn't out of the blue. It was directly after a traumatic incident in my life that I just completely suppressed and chose not to think about. And over the course of a couple of years, I finally put together that what happened to me emotionally deeply affected me physically, and not just affected me physically, but was actually the underlying cause of my very real debilitating back pain and sciatica. And so I went through that whole journey of discovering a mind-body approach and healed my back pain years before. But with pelvic pain, I had a bit of a harder time putting that together because all the information on back pain didn't mention pelvic pain. And I was like, could that be the same thing? And then I kind of realized, oh, my pelvic symptoms, my feeling like I had an infection, happened after a triggering traumatic incident. And so I had to kind of rediscover that mind-body approach that helped heal my back pain and actually use that same approach, but now much more in depth, to actually heal these pelvic pain symptoms. And so in this process, I became a pelvic PT. My symptoms started a year before PT school. And then in PT school, when I was doing all of this work, and then when I came out of PT school, I really had to figure out how to integrate everything I'd learned in my own healing journey with working with patients and clients. So that was a little bit long. I apologize. But that's the fastest I could tell it.
No, that was great. I feel like my story, I can't even get that short. So good job. It's incredible how similar our stories are. Like, let me just start off there. You know, history of back pain. Like, I've struggled with low back pain since middle school, as far back as I can remember. I mean, bladder pain started when I was a kid, so who the heck knows what's going on there? I have my theories. And, you know, getting all of that testing done, like you mentioned the transvaginal ultrasound, and I remember that experience of like a lady literally sticking this like wand in my vagina, and it was so painful, and I was like, what's the purpose of this?
The actual like evaluations were traumatic, right? We talk about like trauma as often like a trigger, but even the experience of getting appropriate care can be traumatic,
Yes.
right? So I'm so sorry you had that experience. I also had a very similar experience, and I just want to name like this. It's a terrible experience to go through.
It is. And you saying like your doctors diagnosed you with all of these different issues. You know, I also had the IC diagnosis. I had the vulvodynia diagnosis. And you're right. They say like, well, there is no cure, you know, and every doctor is different, but I've had a variety of responses like, we can try these experimental things like installations, medications, blah, blah, blah. And then I've had doctors who are like, oh, you're kind of screwed here. You know, this is a lifelong thing. You're probably not going to get relief. And I'm like, okay, then you go into this like gloom and doom black hole. And it sounds like you got yourself out of that a lot sooner than I did. So good for you.
I'm not sure if it was sooner. I think I was in a way, for better or for worse, primed, right? Because I had gone through the back pain experience years before. But even with that, it took me quite a lot to truly believe that this approach could work for pelvic pain, because pelvic pain feels different. By the way, I, like you, had other symptoms as well as a child. Like I had like chronic IBS, I had chronic fatigue, chronic migraines. I had like a history of a lot of like wonky symptoms, unexplained symptoms, right? But I hadn't made the connection at all.
Right.
And so when it came to pelvic pain, I still was like, but this is different. This feels really real. And I think the most important thing that took me forever to really accept is like, oh, it is real. It's just not structural, right? And that can be hard to even believe when, for example, like with vulvodynia, for me, I had visible redness. Like I had visible inflammation. In my urine tests, I had white blood cells and nitrates. Like I had what would appear to be evidence of some kind of inflammation, right? And so if we believe the only way that's possible is with a true infection, it can be incredibly not only hard, but impossible to actually adopt this approach without understanding pain. Without understanding, period.
Right. No, you're so right. And I think, well, first, before I get into what I was going to say, how did it feel for you, or how did you first get into and learn about the mind-body approach?
So originally with my back pain, that came from the book Healing Back Pain by Dr. John Sarno. So this was about 2.5-ish years into my back pain. My dad, who is the least woo person you'll ever meet in your life, was watching the Howard Stern show and was like, listen, he mentioned this book about back pain. You have back pain. Check it out. And I was like, okay, I can read a book. Like, that's fine. I can read a book. And so I read this book in one night and bawled my eyes out, because what really it made me understand were a couple of things. One, what happened to me was not only real, but important for me to acknowledge and understand and process from the traumatic perspective. And that had a very real effect on my physical body. And two, that even though I had like structural abnormalities on scans, like I had a true herniated disc at L5S1, I had bulging discs above that. Like it looked like my spine was collapsing on an MRI. But even with all of that, I could still heal. And that was like so paradigm shifting for me because my perception prior to that was my spine is just collapsing and I have to figure out how to unherniate my discs or unbulge my discs. And the belief that so deeply was my body is broken. And what that book helped me understand was, oh, I'm actually not broken. These are normal abnormalities and I can heal without changing them at all. And I'm going to have to learn to process and acknowledge emotions.
Yeah, that's a tough pill to swallow. I also read that book maybe 2 years ago, and I had really similar feelings about it, just in terms of that was probably my first introduction to all of this nervous system regulation, mind body work, and I it really was impactful for me at least. And I'm glad that you brought that book up. I'll link it in the show notes because I know that then Nicole Sachs kind of took his concepts and like made it into her own, and now she has this really large community. Is that, did you ever dive into her work?
Absolutely. Yeah. So she was super influential to me. I had heard her on a podcast. She was a guest on this podcast that had nothing to do with pelvic pain, but she had brought up TMS. And I was like, oh, yeah. And then I delved back into that whole world and I found her work. I found Dan Buglio's Pain for You YouTube channel. I found Dr. Howard Schubner. I found a whole bunch of people in this space who were talking about pelvic pain being a mind-body condition. And so really, I have to give a lot of credit to Dr. Schubner's book. For me, I was so medicalized and so terrified of my symptoms and pain that I needed like a medical doctor to assure me that pelvic pain can be healed through this approach. And his book specifically mentioned pelvic pain. And that was really impactful for me. And then I was able to go from there and go to Nicole's work and really understand the concepts of self-compassion and radical acceptance and letting things take as long as they take and doing emotional processing work. And that was so important to me. Her podcast, I listened to it like literally every day on the way to PT school, like every single day. And also Dan Buglio's Pain for You channel. He had amazing success stories. He had really like daily videos of like kind of soothing and calming and responding differently to symptoms. That was really impactful for me. And over time, there were more and more people in this space. Alan Gordon's book, The Way Out, was really impactful for me. There were more and more people. Curable app came out eventually. Yeah. Pain Processing Therapy Workbook just came out. There is now so many resources, and there are so many people in the field now who are really legitimizing this work. And there's now science to back it up, which we love.
So thankful for that because it is sometimes hard to convince people, you know, this actually is legit versus it's not just this woo-woo thing.
Well, I think it makes perfect sense, right? Because I think in general, first of all, as women, we are medically gaslit all the time. With pelvic pain, we're gaslit all the time. And it can feel like being told pain is all on your head, which is like literally the worst thing that we can be told because the pain is debilitating and real, right? And so there's a lot of sensitivity to a broader discussion about the brain and nervous system having anything to do with chronic pelvic pain. And that makes sense, right?
Yeah, sure does. I think for me, I did have a bit of a journey with this because at first I had that knee-jerk reaction of there's no way. This is just in my head. Or you have doctors who are like, oh, you have anxiety. Is that could be, you know, the cause of all of this? And it's like, that's hard to hear because yes, I do have anxiety. But again, like you said, my pain is so real. Like I felt like I was peeing hot sauce every single time I went pee when I was a kid through age 25. So it's hard to say like, okay, I'm bedridden, but somehow this is in my head. So I'm glad that we're addressing this here.
But even being told, right? I also was told it was anxiety. And can I swear on this podcast?
Yes, you can. It's encouraged.
And I was literally like, fuck you. Like, you have no idea how bad this is. You have no idea how real this is. How every single day of my life I'm experiencing 10 out of 10 pain. Like, literally, fuck you. Right? And I think that rage, that anger at the medical system was actually part of my own experience of pain. Right? I was feeling so invalidated, so misunderstood, so just, I was being told I was crazy. That's what it felt like. And I'm like, you do not understand. My pain is real. And that's also part of the resistance, right? To exploring this broader perspective is like, it's important to understand the science to help validate that, like, yes, absolutely, your pain is real. And how we approach it has to be different if the underlying cause is the brain and nervous system. And that was the piece that was missing from the doctors who were saying, oh, it's anxiety. It's like, that's not all wrong, but it's also not accurate.
Right.
Right.
Yeah, it took me to read all those books, and then also someone showed me the polyvagal theory like chart, and I was
Mhm.
like, "Oh yeah,
Yes.
this 100% is me. Like I'm in fight or flight. Let's do it. Get me out of here."
Totally, totally. Yes, I got really into like the neuroscience of somatic work and polyvagal theory and Pat Ogden and Deb Dana and all of those beautiful people. Oh, and Peter Levine's book, In an Unspoken Voice. That was super impactful for me, and understanding fight, flight, freeze, fawn, all the different states and responses of the nervous system, to really understand like what my physiology was doing was really eye-opening for me and validating for me.
Yeah. I have recently been, because I know this is a hard topic for some people to process. So I have been trying to make content on social media that is really getting into the science and the research behind it. And, I recently had on one of my master classes, I put the fit criteria by Howard Schubiner. And
Yes.
I know it's a lot, but if you guys are listening, like Google FIT criteria, Howard Schubiner, and it'll pop up. And it's this list of like, what is it? Functional, inconsistent,
Inconsistent and triggered.
triggered, and
Mm-hmm.
it's just like these like statements. I wish I had it up right now, but I feel like a lot of people, when you show it to them that way and they can relate it to their own personal experience, like earlier you said you had symptoms that would change, and like that's one of the things that are on there, and it's just like that, making that connection I think is really big for people.
Absolutely. I use that all the time. First of all, I used it on myself from his book when I first discovered it. And then I use it with my clients all the time as a self-assessment technique. I think it's so critically important to like build your case. Like, I'm never one to like try to convince people that their symptoms are neuroplastic or nervous system driven. I like for them to self-assess and come to that conclusion themselves. And I love to guide and support them in doing that. But I think trying to shove it down someone's throat is not helpful.
That's so
And
real, honestly. Like they need to arrive at their own time. Like you can't force someone to be ready for this stuff.
well, I know that was true for me too, right? Because if a doctor had brought this to me and I was 100% convinced that my pain was structural, it would fall on deaf ears. I couldn't hear it, right? And that may have happened. Someone could have brought that to me and I literally would have been like, again, fuck you. My pain is real, right? And
Yes.
just to validate, if anyone is still in that place, that's okay. It's okay to not be ready to explore this avenue. And I'm hoping our conversation helps perhaps open you to that broader perspective.
I mean, just look at us. I mean, I know I have like 99% symptom relief. I don't know about you. Where are you at today?
Yeah. So I consider myself fully healed from all chronic pelvic pain. I would say I have like maybe one flare up a year during a stressful time where I am not appropriately caring for myself or meeting
Exactly.
my
That's
needs.
exactly how I feel too.
Yeah. So I don't consider that chronic anymore. right? I consider that like being a human. I love when like Nicole says there's no cure for chronic pain, but there is a cure for, there's no cure for human pain. There is a cure for chronic pain. And that really resonates with me because I feel like to have the idea that pain-free 100% is the goal also feels like perfectionism to me, right? It's like humans have pain sometimes, and that's okay. It doesn't mean you're not healed. If one day out of 365, I have pain, that's not a problem.
Yeah, that's so real. You're changing my perspective here because people all the time are like, how did you get in remission? And I'm like, by my standards, I don't consider to be in remission because, stress and everything. But what I wanted to ask you was, as somebody who, had, I guess we can call it like traditional education in the medical field. You're a physical therapist. I'm a dietitian. We came from that background. And I always feel weird and uncomfy when I say the word heal and I hesitate. Have you ever had that feeling? Or do you know what I mean?
A little more context. So you have a hard time talking about someone being fully healed or healing, or what is the discomfort?
I feel like I struggle because I see, and a lot of these conditions, there technically is no cure. So it feels weird to say that, oh, I'm healed.
Yeah. So here's my perspective on that and why I'm okay saying healed. This might be controversial. It probably is controversial. I don't consider IC really a disease. The same way I don't consider pudendal neuralgia or vulvodynia a disease. It is a diagnosis. And really, it's given as a diagnosis of exclusion. It's saying you have this cluster of symptoms. We're going to give it this name. This is your diagnosis.
Yeah, because you can't explain it otherwise.
You can't explain it otherwise. But that doesn't mean that you have like a specific physiological structural condition. So if we view all of these diagnoses as neuroplastic symptoms, like the overall overarching umbrella term of neuroplastic symptoms, those are curable. Those are healable. Those are rewirable. And so I actually don't feel uncomfortable saying curable or healable through that lens. Now, something like endometriosis is a different discussion for me, and I'm happy to talk about that if that's interesting to you. But there are some diagnoses I for sure am like, yeah, we can 100% like heal or cure this diagnosis. And others where I'm like, we can get a lot of symptom resolution or full symptom resolution, but there is a disease process that is true and physical and structural that is just part of the condition.
No, that makes so much sense. And it actually is going to help me probably adjust my language in the future. I think that's a lot of personal things we don't need to get into, but I would love to hear your perspective on endometriosis with us.
Yeah, so I've been doing a lot of reading and talking to other experts in the field who are really experts in endo specifically. And listen, endo, 1,000% is real and structural. There are for sure structural aspects and components to that condition. We also know that when people have excision surgery, a lot of them do not find symptom resolution or even relief sometimes. And we also know that the severity of the disease or the degree of severity of the disease does not correlate with symptom severity. So it is not just the endo lesions that are causing pain. Now, this is pain specific. This is not related to fertility, for example. And so what we've discovered, by we, I mean research, not me, research has discovered, is that we can actually assess and see who would benefit most from an endo excision procedure from a pain perspective, and whose pain is actually primarily driven by the nervous system. And so a good proportion of people who think that their pain is really the result of endo is more driven by the nervous system. And there's an assessment called the CSI, or the Central Sensitization Inventory, that can help you assess whether your symptoms are primarily driven by the nervous system, in which case a neuroplastic or mind-body approach could actually find tremendous relief or even resolution of pain symptoms.
Yeah, we should link that in the show notes. Okay, that's really interesting. I think my next question for you is when you're talking about this neuroplastic approach, what did that look like for you versus how are you helping other people? Like, what is your approach now versus what did it look like for you personally?
Yeah. So the very first thing I had to do was like understand pain. I had to understand pain, like the actual up-to-date neuroscientific definition of pain, which I'm just going to give you because I think your audience may benefit from it. I hope I have this word perfect. But pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. Now, that's a whole lot of words.
Did you
But they're there.
memorize that?
I did memorize that. I talk about it a lot.
Got it, got it.
So I talk about it a lot because I think it's really important and like kind of critical to understand. Because basically the take-home points of that is that pain is always both sensory and emotional and is an experience. It does not live in the tissues. Okay? And there does not have to be any actual tissue damage for very real pain to occur. And those 2 points, I think, are paradigm shifting when looking at how we actually address and treat pain. So that's the first thing, is understanding pain. Now, going from there, right, we have to figure out, okay, so now what? It's an experience. Now what? Right? And so really we're looking at pain is a danger signal. It says something is wrong. It doesn't tell you what is wrong. It says something is wrong. And we can get pain when our nervous system perceives a threat, whether it's physical or emotional, the result can be the same. It's physical pain. And so I had to really self-assess and see, okay, why is my nervous system feeling under threat? And I found all kinds of fun things. Not fun. They were not fun at the time. But I found a lot of factors for why my nervous system was feeling under threat. Namely, I still did not know how to feel and process emotion. I still suppressed and repressed emotion. I thought they were extraneous and annoying. I didn't want to do it. I was incredibly hard on myself, really mean to myself, very perfectionistic, very goodist, really wanted everyone to like me all the time and always. I had no boundaries, could not say no, let everyone just, like, everyone's opinion was more important than my own. I did not literally feel safe in my body or my life because I couldn't self-advocate. The list goes on. Like, I had all of these factors that were really contributing to this constant state of danger in my nervous system. And so I had to piece by piece understand this and start to address it. So that looked like, first, recognizing my body was always on my side. I had this whole story about how my body was broken. I had hated my body my entire life. I grew up in a fat body. I've always had a fat body. I've always wanted to have a thin body. I've always been dieting for like literally my entire life. And recognizing that being in that state of constantly trying to eat less, look different, pick myself apart was contributing to a whole lot of danger in my nervous system. So I had to learn to really befriend my body and not make it the enemy like it had been my entire life. That was a really big component. I had to learn self-compassion. I had to learn to be kind to myself. I literally didn't know that was a thing. I was living with a constant like inner drill sergeant who was like, do better, be perfect, get this right, get your A+. Like, I was living with a lot of pressure in my system. So I had to learn to, well, try to do like B+ work instead of A+ work, which was really hard in like every way, right? Like in every part of my life, not just school, like every part of my life. In school, I still got A's. I couldn't let that go. And I really had to learn to like like live before the pain ever changed. I had to learn to like not stay in bed, but go out and see friends, to go back to the gym and not be afraid of doing core work. That it's okay that my pelvic floor is tight sometimes. Like that was not actually the underlying problem, even though that was true. We can talk about that also. But I really had to learn to like take care of myself authentically and like speak up for myself and find my voice and live in integrity with myself. And that was a process. Like that did not happen overnight. And another big component besides like the getting to know myself and take care of myself piece was changing my relationship to the symptoms themselves, because I was terrified of my symptoms. And so I had to learn how to do things like graded exposure, imaginal exposure, ride the waves of incredible pain flares and keep my body calm and really hold myself through the process, which required a lot of self-compassion.
What you just said at the end there is so common among my clients, and I'm sure a lot of the listeners here, like fearing your symptoms, being just so afraid. And then you go down that rabbit hole of like catastrophizing and thinking about the future and then feeling hopeless. So you're so right with all of that.
Yeah, I think I remember doing this myself, and I see my clients do this as well, which is we project into the future like the worst case scenario. And by the way, like that is a result of our nervous system, right? Like Deb Dana's thing is our thoughts are a reflection of our nervous system state, right? So when we are living in fight or flight, we are ripe for catastrophizing and for ruminating. And so it's so normal and natural for our brains to just go there, right? It feels protective. And it actually harms us in the present moment and makes it harder for us to actually like do the work we need to do to actually heal.
Mm-hmm. Yeah. Can you talk a little bit about like how that is harmful in the moment?
Yeah. So, okay. So if pain is a danger signal, the antidote is safety. When we are projecting a really scary future, we do not feel safe. So we are freaking out about our symptoms, which again, I want to normalize as like normal and human. And it dysregulates us further. So we're getting more into that threat physiology, which tells our brain we're actually in danger, which actually turns up the dial of our symptoms. So we physically feel worse, we emotionally feel worse, and we're not learning how to respond to our symptoms with more safety.
Mm-hmm. Okay. And I think this is something that is probably really difficult to, start adopting all the things that you said. Do you have any like small action steps for people who are listening to this that they can start doing some of this stuff?
Yeah. So as far as like responding differently to sensations, I think the first step is just noticing how you respond, right? Just awareness first. Like when I get a sensation of burning, what is the first thing that I do? Do I like keep monitoring and checking? Do I panic? Like what is the action that I take or the thought that I think? And how might I start to interrupt that? Right. So often I encourage my clients to use a more somatic practice as an interruption tool or technique. That could be very simple breath work, like a 4-7-8 breath or a boxed breathing, anything to just bring a little bit of soothing and regulation to the nervous system.
Side
And
note,
then,
I
yeah.
love 4-7-8 breathing. I have never been someone who buys into breathing and meditation, but the first time I did 4-7-8 breathing, I was like, what kind of sorcery is this? Like,
I felt very similarly. I also really resonate with that practice and it works really well for me. And I want to offer like there are so many different practices one could try. No one single practice is a magic bullet or is going to heal you. So just notice what feels good for you. What helps you feel like 2% more at ease. Now, symptoms may not change at all, and that cannot be the goal, right? The goal is to have a little bit more capacity to be with whatever the experience currently is.
mhm.
That's the goal of regulation practice.
Yeah, that's
Okay.
something I've been learning in the pain reprocessing therapy workbook is the concept of outcome independence.
Yes. Huge and so hard to do. And that's something I really spend a lot of time with my clients working on is the practice, right? Thinking about it as a practice. I think there can be so much pressure to be outcome independent and just get there. But pain is scary. Like it's literally created to be scary. It's supposed to stop us and make us like pause and assess, right? And so it is normal and human of us to respond with fear. And to move towards outcome independence is going to take reps and compassion.
For sure. That's something that I need to be better at. My clients know I'm a very typically non-compliant type of patient. I do not practice what I preach very well, but it is a work in progress.
Isn't everything, right? Everything's a work in progress.
For sure. Um, so that's kind of a couple things that you did. Is there anything else that you did that was really helpful for you in getting from point A to point B?
I would just say being really patient with myself. I would say giving myself, again, learning compassion. I keep saying that because it was really paradigm shifting for me and I was really resistant to it. And I was like, this is some bullshit that I don't need to do. But it is like the biggest balm and salve of safety to the nervous system to create like a safe experience with yourself. And that's what compassion really does. And I think also boundary work. I think it's really, really hard to heal when we don't know how to set boundaries. And if our nervous system perceives that it has to protect us with symptoms for us to be safe, it will keep doing that.
Can you give an example of a boundary setting scenario?
Sure. So for example, this is like a very non life or death one. But say a friend is meeting you for coffee and they are chronically late. Like they are chronically an hour late. And you've asked them several times, like, listen, I have a lot to do. I'm making time for you. I only have this period of time. Please try to be on time. And they are consistently an hour late. You can say, hey, I still want to hang out with you. I really do. And I will not be able to make plans with you if you are continuing to be late. So if you're unable to show up on time or within like a 10-minute time frame, I'm not going to be able to make plans with you anymore.
I like that.
And that can feel harsh, right? But this is something that's you've made the request several times and they're unable to accommodate. They've been unable to respect your time and the boundary that you've set. And so that feels more like an ultimatum. But that's like the last level of self-protection to say, okay, my needs really matter. And I'm not going to continue to abandon myself because they're unable to do the thing that I asked. Right?
Yeah. A
And that can
situation
be
like that is so incredibly frustrating. And, you know, I can relate to not wanting to be confrontational. You know, I'm your typical perfectionist, people pleaser. I want to avoid conflict, but I can recognize that that is, you know, my dysregulated nervous system trying to protect me. So I think that's a great example.
1,000%. And that's something that I would have ignored and shoved down and stifled and said, it's fine, and made a million excuses for why they're late. Like I have been in this situation many times, right? And I'm like the most, whether it's a trauma response or not, the most understanding person. I give a lot of chances, right? And at some point I was like, am I really like being understanding or am I in a fawn response? Like, am I just trying to preserve connection to my own detriment, right? And so only we can know what's true for us. And people are fine to wait an hour. They're like, whatever, I actually don't care. But I actually did care. And I think acknowledging that was a really big step for me to recognize how many places, even the tiniest of places, I was actually self-abandoning.
Mm-hmm. Yep. Yeah. Thanks for giving that example. I think that's really helpful. Um, I think next I want to hear more about like how you took your personal experiences and now you are creating or have created a course for people struggling with this type of thing. So can you talk more about like your methods, your beliefs, and what people are going to be doing in that course?
Absolutely, yeah. So I have been working with clients one-to-one for the past, gosh, where are we? Almost 4 years. And been running groups twice a year, which has been awesome. But now I'm really ready to hopefully get this into more people's hands at a more accessible price point. I sincerely hope. And really, I always work the same way, no matter what the context is. In that, I am always working through a mind-body approach. So I have what's called like the pelvic pain freedom formula that everything is based off of, which is understanding pain, befriending your body, reclaiming pleasure, joy, rest, and play, and re-engaging in life. And so the course, which is called Beyond Chronic Pelvic Pain, will really guide clients through the pillars of this process and help them work through implementing a mind-body approach in their own lives while returning to living a full and empowered life. And I'm including things like different somatic practices, talking about sex and returning to intimacy with pelvic pain, getting back to movement and the activities they enjoy through things like different kinds of exposure therapy, and really connecting to their values and living a life in alignment with their values. So I'm trying to make it as inclusive and holistic as I can. It's really the path I walk my clients through in one-to-one coaching, but this will be a self-paced course that clients can kind of pop in and out of and really have in their back pocket forever. That's the goal.
That's great. It sounds awesome. I'm glad that you're including like exposure therapy because that's something a lot of people need. I see in my clients so much food fear and
Yes.
fear. I mean, you were just talking about like fear of sex, maybe not fear, but stress surrounding the idea of being physically intimate or getting back to the gym. I just was talking to one of my clients and she was saying how her PT told her not to do any sort of leg workouts because she has a tight pelvic floor, and she went into this fear response. And I think that type of exposure therapy could be really helpful for people, especially in like the ICOAB realm.
I honestly think that exposure therapy is like kind of unfortunately always the answer. When it comes to these symptoms, especially and the different triggers that we have, that's basically the main tenets of pain processing therapy, right? Is like somatic tracking and different ways to expose yourself to the things that you're afraid of and rewiring those neural pathways. And I think that that's the work that clients do not want to do because it's scary, and that makes so much sense. So having like guidance on how to actually do that in a way that feels possible is really what I'm trying to create. And I just want to name that, like, yeah, it sucks. It sucks because I remember feeling so afraid of all of these things. And for me, fear was the appropriate word. Some folks may say like stressed or anxious or whatever the flavor of fear they may
The
call it.
flavor?
Yeah. I think that was a language from Vanessa Blackstone, actually, from the PRT workbook.
Love that.
But really, it's all the same thing, which is our brain is perceiving threat. And how do we change that threat appraisal and create safety instead? And that's really the work.
Mm-hmm. Okay, so I'm gonna link your course in the show notes because I think it'll be launched by the time we publish this, right?
Awesome. Yes, it's coming out March 23rd.
Okay, amazing. So I guess the way I want to wrap this up is, are there any, small action steps that people listening to this episode can take today to support their nervous system on a day-to-day basis?
Yeah, so many.
Baby steps.
Yeah, we love a baby step. There are many, and every little step counts. So I think the first thing I'll say is if you can slow down in your mornings. Now, I know that sounds like it could be really hard, but what I want to offer is slowness is such a massive signal of safety to the nervous system. And even if you do everything exactly the same, if your routine is exactly the same, you just do it in like maybe half speed or like 3/4 speed, that helps signal the nervous system, oh, we're actually safe now. We don't have to be urgent and rush. And that can be such a massive change at the start of the day. And so I would invite folks to give it a try and seeing, do I usually rush through my morning? Where can I slow down and be more present and mindful? And recognizing that as actually part of healing.
Love that. I need you to tell my boyfriend to not check his email right when he wakes up in the morning. I'm like, what do you think you're doing here? You're automatically stressed when you read your first email.
Yeah, we can talk about screen time boundaries. Like there's so
Yeah.
many boundaries we can set with ourselves also, right?
Screen time
But
boundaries are fantastic.
yeah, great.
Yeah. My mind is a TikTok mush. So, yes, please talk about that.
Yeah, I mean, like what is more dangerous than being on a device that just spews all kinds of the most clickbaitable information, right? So it is the loudest, the most colorful, the scariest, and it keeps like the algorithm is like designed, whatever app you're on is designed to keep you on it. And it usually taps into our fear most of the time. So whether it's news, whether it is like just terrifying stories, whether it is, I mean, things that we think that we need to have, like scarcity and shopping kind of a thing, like it's endless. And we always feel inadequate or unsafe at the end. So how can we think about tailoring our screen time in a way that feels supportive for us? Maybe that means unfollowing certain people. TikTok is different because that algorithm just does its own thing. Instagram, you can tailor a little bit more for like what you're looking for. But either way, having like a discrete period of time where you're letting yourself actually go on and it not being first thing in the morning or last thing at night. That's where I'd start.
Yeah. That's a good place to start. You also, I was looking at a post when I was putting this together of little um, steps people can take to support their nervous system. And I like that you included making space and time for joy, pleasure, rest, and play, even when symptoms are present.
Yes. Huge. And that is honestly sometimes the hardest work for my clients to actually do because I think healing or getting, not even healing, quote unquote, getting rid of symptoms can feel so urgent. And again, we heal in slowness when we are in the states of rest, joy, pleasure, and play. Our physiology is getting the message. In this moment, I am safe. You're in your parasympathetic rest and digest physiology. And we are having our happy chemicals of serotonin, oxytocin. Like we're in a physiology in our body that sends messages to the brain saying we are safe. So from a structural, like biological perspective, we are in healing physiology and we get to enjoy ourselves before the pain goes. I think it's so important to make space for actually feeling good, for doing things we care about as we're healing and not putting it off until we're pain free. I think that will also make healing feel less urgent if we allow ourselves those opportunities during the journey.
I love that. I think that's a great place for us to wrap this up. Is there anything else you wanted to say that you feel like we didn't touch on?
Let's see. I think we covered a lot. I just want to say that wherever you're at in your journey, I think there's so much hope for healing. I think if you're curious to learn more about this approach, there are so many resources now available. And I can't say this enough, all pain is real, but we have to understand the underlying mechanism to appropriately treat it. If pain is driven by the nervous system, we have to include the nervous system in our approach to healing. And so if that's been missing for you, there is so much more healing available.
Yep. Mic drop. I love that. Okay, a side note, everybody should go follow Rachel on Instagram because she puts out some really good content. I think you do a really good job of like not only having good information, but making it look really pretty and really nice for the nervous system. It's calming.
Thank you, Callie. I appreciate it. I try.
Yeah. Oh man. Well, I will link that in the show notes. But Rachel, thank you so much for coming on and sharing your wisdom. We really appreciate it.
Thank you so much for having me. It was an absolute pleasure.
Summer is coming and you want to be excited, but if you're living with bladder symptoms, summer plans can feel more stressful than fun. Pool days, you're worried about chlorine triggering a flare. A weekend getaway sounds great if only you weren't constantly scoping out bathrooms. Even just grabbing dinner with friends can feel like a gamble because, let's be real, you're tired of playing, will this meal ruin my night? But what if this summer could be different? Imagine saying yes to that trip, that dinner, that spontaneous beach day, without worrying about your bladder holding you back. Imagine feeling confident, free, and finally at home in your body again. That's exactly what's possible for you inside Road to Remission. This life-changing program helps you get to the root cause of your bladder symptoms so you can finally get lasting relief. Through personalized nutrition, nervous system regulation, in-depth education, and compassionate support, you'll learn exactly what your body needs to heal so you can get your life back. We've helped over 200 women get relief from their bladder symptoms, and you could be next. So if you're ready to stop just managing your symptoms and start actually healing, join Road to Remission today. Apply now at the link in the show notes, because this summer, it's your turn to live.